Bipolar disorder or ADHD. Attention deficit hyperactivity disorder, ADHD, and bipolar disorder have similar symptoms. This is so much the case that they're often misdiagnosed for one another. But this doesn't mean that they don't show up together. Bipolar disorder and ADHD, or attention deficit hyperactivity disorder, are two conditions that are being diagnosed more and more in American children and teens, often together. Medical science is learning more about bipolar disorder in children and teens. But the condition is still difficult to diagnose. That's especially true for teenagers in whom irritability and moodiness commonly coexist as part of a normal adolescence. A preteen or teenager with mood swings may be going through a difficult but normal developmental stage. Or they may have bipolar disorder with periodic mood changes that shift from depression to mania. Symptoms of ADHD can have some overlap with symptoms of bipolar disorder. With ADHD, a child or teen may have rapid or impulsive speech, physical restlessness, trouble focusing, irritability, and, sometimes, defiant or oppositional behavior. According to one study, today's children and teens are 40 times more likely to be diagnosed with bipolar disorder than they were 10 years ago. The reason isn't entirely clear. There are those, though, who say it could be a result of a lack of parenting that leads to behaviors that are tagged as mental illness or other conditions misdiagnosed as bipolar disorder. Some studies have shown that children and teens diagnosed with bipolar disorder are more likely than adults to also be diagnosed with ADHD. Bipolar disorder is primarily a mood disorder. ADHD affects attention and behavior. It causes symptoms of inattention, hyperactivity, and impulsivity. While ADHD is chronic or ongoing, bipolar disorder is usually episodic, with periods of normal mood interspersed with depression, mania, or hypomania. There's a limited amount of research examining the best treatment option for people with ADHD and bipolar disorder. Once bipolar symptoms are under control, then ADHD can be targeted with medication. Bipolar disorder and attention deficit hyperactivity disorder, ADHD, are conditions that affect many people. Some of the symptoms even overlap.